I feel like, I was put on this earth to make people feel better. And so if I can help people gain insights or just a little glimmer of hope or movement through a difficult process, I feel fulfilled. When a client is fulfilled, I feel fulfilled. And that's what I've been put on this earth to do. So I have been a board certified music therapist for almost 20 years. I received a Bachelor's of Music Therapy at Shenandoah University, as well as a Master's of Music Therapy there. My full-time job is music therapist with Blue Ridge Hospice. I also am adjunct faculty at Shenandoah University teaching music therapy. And what made me want to open the supplemental private practice is to help balance out the work that I do and to focus more on overall wellness, integration of mind, body, and spirit. So I've been practicing in my private practice for about 5 years. It's actually a type of psychotherapy. It requires extensive training. It took me about 5 years to become a fellow in this particular intervention. I like to relate it very closely to a waking dream, if you will. It can be an experience that's very visual, it can be felt in the body. Basically, a person comes, we develop a goal or intention for the visit. Depending on what that intention is, I choose prescribed music. A person is in a relaxed state, the music is put on, and a dialogue is exchanged through the whole experience. The idea is that the client will connect with their inner psyche and be able to derive insights that will lead to further integration of mind, body, and spirit. So it is a therapeutic process. A common misconception is that it is for relaxation, and it's not that. It is a type of therapy. So I would like to say that everyone could benefit, of course, but I specifically specialize with people that are experiencing grief and loss, depression and anxiety, eating disorders, issues with relationships with other people as well as themselves, past trauma experiences. It is basically anyone that's open to the experience could definitely benefit. I also do online work, which is just as effective. So people are able to come to my private practice, or we can do Zoom. And like I said, it's just as effective. So we all know if something is out of whack, so something physical is out of whack, we're going to feel unbalanced. So the goal of this particular intervention is to integrate all the processes together so we feel balanced, better in check. We talk about what brings them to the practice. We really spend time coming up with that goal or intention. That can be hard for the first time. We talk about the process, what someone can expect, the questioning that might occur. Them kind of taking a few moments thinking in their head, like, is this what I'm really experiencing? I don't really know. So just expectations. And then an actual session takes place. Following the session, there's a post-session where we're really working hard to integrate their experience and really therapeutically talking about what was significant, how it relates to their goal or intention. And then there's an additional piece, whether that's journaling or doing a small mandala or something that's going to be, they can take away with them and be integrated. As far as the process of the actual session, after we come up with that goal, the client usually lies down on the massage table, covered and relaxed. We get them into a very relaxed state through breathing, whatever works best for them. I reflect their intention or goal back to them, and then I put on the prescribed music. And as the experience unfolds, I'm really just asking questions to help guide them, not interpret their experience. So questions such as, what are you aware of? How do you experience that in your body? Just questions to help deepen their experience. As the experience is unfolding, I'm taking notes about the dialogue to help us reflect at the end of the session. Once the music ends, the client is kind of brought back to a more ordinary state, and we kind of talk about what is significant, what occurred, what stands out to them. And then, like I said, the last part is to engage in a journaling or mandala type activity to bring closure to the experience. I have extreme flexibility as far as when to schedule, so I can come during the day, I can come in the evenings, I can come on the weekends. So that's certainly available. Online is available. It can be done in your home if that's where you feel most comfortable, or it can be done in person. So many clients that come to me are receiving some sort of type of counseling services, so talk therapy, other sorts of interventions. And this particular intervention is certainly not meant to take the place of any type of therapy, but it really adds to the experience. So for example, someone can come to me 1 week, they can gain insights about a particular issue, they can bring it back to their counselor the following week and work on that, and then vice versa. So they really work hand in hand, and a lot of the feedback has been that what clients are able to get from this particular intervention, it's a quicker process than talk therapy. So they're able to gain those insights quicker, they're able to bring feedback back to their counselor, and they really work very well in conjunction with each other.